If you've been carrying extra weight around your midsection and feeling frustrated by how stubborn it is, this may be the most important message you hear today. That deep belly fat wrapped around your organs, called visceral fat, isn't just about appearance. It's actively interfering with your metabolism, raising inflammation, and increasing your risk of diabetes and heart disease. But here's the hopeful part. Recent research shows that targeted strategies can start reducing visceral fat within 30 days. Today, we're walking through 6 science-backed steps that work specifically on this dangerous fat. Let's begin with Step 6 and work our way to the most powerful one. Step 6. Prioritize high-quality protein at every meal. When it comes to burning visceral fat, protein isn't just important, it's essential. Your body uses significantly more energy to digest protein compared to carbohydrates or fats, and this metabolic boost directly targets the fat stored deep in your abdomen. A 2019 study published in the Journal of Nutrition found that seniors who increased their protein intake to at least 25 grams per meal experienced a 23% greater reduction in visceral belly fat over 12 weeks compared to those eating lower amounts. Why does this matter so much for visceral fat specifically? Protein triggers the release of hormones that signal fullness and reduce appetite, particularly for the processed foods that feed visceral fat accumulation. It also preserves your lean muscle mass, which is critical because muscle tissue burns calories even when you're resting. After age 60, we naturally lose muscle unless we actively protect it, and that muscle loss slows our metabolism, making visceral fat even harder to shift. The best sources for seniors include eggs, Greek yogurt, wild-caught fish, chicken breast, and plant-based options like lentils and quinoa. Aim for a palm-sized portion of protein with each meal. If you're having trouble meeting your needs through food alone, a high-quality whey or plant-based protein powder can help bridge the gap. The key is consistency. Your body needs that steady protein supply throughout the day to maintain the metabolic advantage. Don't underestimate this step. Many seniors unknowingly eat most of their protein at dinner and very little at breakfast or lunch. That pattern doesn't support visceral fat loss. Spread your protein evenly across 3 meals, and you'll notice your energy improves, your hunger decreases, and that stubborn belly fat starts responding in ways it hasn't before. Step 5. Add soluble fiber to slow sugar absorption. Visceral fat thrives on blood sugar spikes. Every time you eat refined carbohydrates or sugary foods, your blood sugar surges, insulin floods your system, and your body preferentially stores that excess energy as visceral belly fat. Soluble fiber changes this pattern completely. It dissolves in water to form a gel-like substance in your digestive tract, dramatically slowing the absorption of sugar into your bloodstream. Research from the American Journal of Clinical Nutrition followed over 1,100 adults for 5 years and found that for every 10-gram increase in daily soluble fiber intake, visceral fat accumulation decreased by 3.7%, even without other dietary changes. That might sound small, but over weeks and months, it creates a profound shift in how your body handles food and stores energy. The best sources of soluble fiber include oats, flax seeds, Brussels sprouts, avocados, sweet potatoes, and legumes like black beans and chickpeas. You can also find it in apples, pears, and citrus fruits. Start your day with a bowl of steel-cut oats topped with ground flaxseed, and you've already given your body a powerful tool for burning visceral fat throughout the day. Most seniors skip this step. Don't make that mistake. Fiber isn't flashy, but it's one of the most reliable ways to control the insulin response that drives visceral fat storage. Aim for 25 to 30 grams of total fiber daily, with at least 10 grams coming from soluble sources. If you're not used to eating much fiber, increase gradually to avoid digestive discomfort. Drink plenty of water as you add more fiber, since it needs fluid to work properly. One more benefit worth noting: soluble fiber feeds the beneficial bacteria in your gut, and emerging research shows that a healthy gut microbiome directly influences how much visceral fat you carry. The connection between gut health and belly fat is stronger than most people realize, and soluble fiber supports both. Step 4. Incorporate resistance training twice weekly. Cardio alone won't solve a visceral fat problem. While walking and swimming improve your overall health, they don't create the metabolic demand needed to specifically target deep abdominal fat. Resistance training does. When you challenge your muscles with weights, resistance bands, or even bodyweight exercises, you create microscopic tears in muscle fibers. Your body repairs those tears, building stronger, denser muscle tissue, and that tissue becomes a furnace for burning visceral fat. A landmark 2021 study in the Journal of Applied Physiology compared two groups of seniors over 16 weeks. One group did only aerobic exercise, while the other combined aerobic work with resistance training twice per week. The resistance training group lost 34% more visceral belly fat, even though both groups burned similar total calories. The difference came down to muscle preservation and the metabolic boost that strength training provides. Here's what makes resistance training so effective for visceral fat: it improves insulin sensitivity in muscle cells, meaning your body becomes better at shuttling glucose into muscles instead of storing it as belly fat. It also elevates your resting metabolic rate for up to 48 hours after a workout, so you're burning more calories even while you sleep. You don't need a gym membership or complicated equipment. Start with bodyweight squats, wall push-ups, and seated resistance band rows. Focus on large muscle groups, legs, back, chest, because working bigger muscles creates a greater metabolic response. Aim for 2 sessions per week, with at least one rest day between workouts. Each session can be as short as 20 to 30 minutes. Use a weight or resistance level that feels challenging by the last few repetitions, but never painful. Stay till the end, because step 1 is often overlooked but incredibly powerful. As you build this habit, remember that consistency matters more than intensity. 2 modest resistance sessions every week will reshape your metabolism and give your body the signal it needs to release visceral fat. Step 3. Manage cortisol with daily stress reduction. Chronic stress is one of the hidden drivers of visceral belly fat, and it operates through a hormone called cortisol. When you're under constant stress, whether from worry, poor sleep, or physical strain, your adrenal glands release cortisol to help you cope. In small doses, cortisol is protective. But when it stays elevated day after day, it tells your body to store fat preferentially around your organs. This isn't random, it's a survival mechanism, an evolutionary response designed to keep energy reserves near vital organs during prolonged stress. A 2020 study published in Psychoneuroendocrinology found that seniors with consistently high cortisol levels carried 47% more visceral fat than those with normal cortisol patterns, even when their total body weight was similar. The research was clear: managing cortisol isn't optional if you're serious about reducing visceral belly fat. When 71-year-old Mr. Tarek started following a simple daily stress reduction practice, he noticed changes within the first 2 weeks. His sleep improved, his appetite for sweets decreased, and his waistline began to shrink in ways it hadn't responded to diet alone. He hadn't realized how much chronic worry was affecting his body until he gave it consistent relief. You don't need hour-long meditation retreats. Just 10 to 15 minutes of intentional relaxation daily can lower cortisol significantly. Deep breathing exercises, progressive muscle relaxation, gentle stretching, or even sitting quietly in nature all activate your parasympathetic nervous system, the counterbalance to stress. Some seniors find benefit in journaling, prayer, or listening to calming music. The method matters less than the consistency. Another practical step: protect your sleep. Poor sleep raises cortisol, and high cortisol disrupts sleep, creating a vicious cycle that feeds visceral fat accumulation. Aim for 7 to 8 hours of quality sleep in a cool, dark room. Avoid screens for an hour before bed, and establish a calming bedtime routine. Your cortisol levels will stabilize, and your body will finally have the internal environment it needs to let go of that stubborn belly fat. Step 2. Try intermittent fasting to boost fat oxidation. Intermittent fasting has gained attention in recent years, and the research on its effects on visceral belly fat is compelling, especially for seniors. This approach doesn't focus on what you eat, but when you eat. By extending the time between your last meal of the day and your first meal the next morning, you give your body an extended window to burn stored fat for energy instead of relying on incoming food. A 2022 study in Cell Metabolism tracked adults who practiced a 16-hour fasting window, eating only during an 8-hour period each day, for 12 weeks. Participants experienced a 25% reduction in visceral fat, along with improvements in insulin sensitivity and inflammatory markers. The key was that during the fasting window, insulin levels dropped low enough for the body to access and burn visceral fat stores, something that's difficult to achieve when you're eating throughout the day. For seniors, a gentler approach often works best. Instead of jumping into a strict 16:8 pattern, start with a 12-hour overnight fast. Finish dinner by 7 p.m. and don't eat again until 7 a.m. Once that feels comfortable, gradually extend to 14 or 16 hours. Many seniors find that eating between 10 a.m. and 6 p.m. feels natural and sustainable. You might think you've tried this before. Wait till you see how step 1 amplifies everything. Intermittent fasting works particularly well for visceral fat because it addresses insulin resistance, the root metabolic problem that allows visceral fat to accumulate in the first place. When insulin stays elevated all day from constant eating, your body never gets the signal to burn stored fat. Fasting creates that signal. A few important notes: stay hydrated during your fasting window. Black coffee, plain tea, and water are fine and won't break your fast. If you take medications with food, consult your doctor before trying intermittent fasting. And listen to your body. If you feel weak or dizzy, shorten your fasting window. The goal is metabolic flexibility, not deprivation. Step 1. Consider Tesamorelin for targeted visceral fat reduction. This is the step most people don't know about, but it represents one of the most scientifically validated approaches specifically for visceral belly fat. Tesamorelin is a synthetic peptide that mimics growth hormone-releasing hormone, and its primary action is reducing visceral fat while preserving lean muscle mass. Originally developed to treat lipodystrophy in HIV patients, researchers discovered its remarkable ability to target the exact type of fat that endangers senior health. A groundbreaking 2010 study published in The Lancet followed 412 adults with excess visceral fat who received daily Tesamorelin injections for 26 weeks. The results were striking. Participants experienced an average 15% reduction in visceral belly fat, measured by CT scan, with minimal loss of subcutaneous fat. Even more impressive, when participants stopped treatment, many maintained their visceral fat loss for months afterward, suggesting the treatment helped reset metabolic patterns. How does Tesamorelin work? It stimulates your pituitary gland to release more growth hormone, which declines naturally as we age. Growth hormone plays a critical role in how your body distributes and burns fat. By restoring more youthful growth hormone patterns, Tesamorelin shifts your metabolism away from visceral fat storage and toward fat burning. It also improves insulin sensitivity, making your body more efficient at using glucose instead of storing it as belly fat. Tesamorelin is administered as a daily subcutaneous injection, typically in the abdomen. The most common side effects are mild and include injection site reactions, joint pain, and occasional water retention. Importantly, it doesn't cause the dangerous side effects associated with synthetic growth hormone itself, because it works indirectly by stimulating your body's own production. This treatment isn't for everyone, and it requires medical supervision. It's currently FDA approved specifically for HIV-related lipodystrophy, though some physicians prescribe it off-label for visceral fat reduction in other populations. The cost can be significant, and insurance coverage varies. But for seniors struggling with stubborn visceral belly fat despite diet and exercise, Tesamorelin represents a targeted medical option worth discussing with your healthcare provider. The research is clear: burning visceral fat requires a different approach than losing general body weight. Tesamorelin directly addresses the metabolic dysfunction that allows visceral fat to accumulate and persist. When combined with the other 5 steps we've discussed, it can accelerate results and help you reach a healthier body composition faster than lifestyle changes alone. Visceral belly fat isn't just a cosmetic concern, it's a metabolic threat that deserves your attention and action. But as we've seen today, you're not powerless against it. These 6 steps work together to address the root causes: insulin resistance, muscle loss, chronic inflammation, stress hormones, and metabolic slowdown. You don't need to be perfect. Start with the steps that feel most achievable, build consistency, and add the others as you're ready. Some of these strategies will show results within days, while others take weeks to reshape your metabolism. Be patient with yourself, but stay committed. Your body is capable of remarkable change, even after decades of carrying excess visceral fat. Every meal, every workout, every moment of stress relief is sending signals to your cells about what kind of body you want to build. Small daily choices can protect your future. Thank you for being here and taking this time to invest in your health. We'll see you in the next video.